Dr. Sila Biolabs presents The Complete Science of Dental Scaling.
Many people believe scaling weakens teeth, but the truth is very different.
Bleeding gums, bad breath, gum recession, and loose teeth often begin with a hidden enemy. That enemy is dental calculus, commonly called tartar.
What exactly is calculus? How does it form? And why must it be removed? In this documentary, we'll follow the complete journey from plaque to periodontal disease. We begin with something that forms on every tooth, every single day. Plaque. Plaque is a living biofilm made of bacteria, saliva proteins, and food debris.
Within minutes after brushing, bacteria begin attaching to teeth again.
First, a thin protein coating called the acquired pellicle forms on enamel.
Early colonizing bacteria quickly attach to this surface.
As these bacteria multiply, they begin forming organized communities. This organized bacterial community is called a biofilm.
Plaque is not random bacteria. It behaves like a complex living ecosystem.
Every meal provides nutrients that feed this growing biofilm, especially sugars and refined carbohydrates. When bacteria consume sugar, they produce acids and inflammatory toxins. These acids can damage enamel and initiate tooth decay.
But plaque causes even greater damage to the gums.
The body recognizes plaque bacteria as foreign invaders.
This triggers inflammation. Gums become red, swollen, and sensitive. One of the earliest signs is bleeding during brushing.
This early stage is called gingivitis. The good news is that gingivitis is still reversible. At this stage, proper cleaning can restore gum health. Problems begin when plaque remains on teeth for extended periods. Days become weeks.
The biofilm becomes thicker and harder to remove. And now another important player enters the story. Saliva contains calcium and phosphate minerals. These minerals begin depositing within plaque. Gradually, the soft biofilm starts hardening.
This process is called mineralization. And plaque begins transforming into calculus. Unlike plaque, calculus is hard and firmly attached. Once calculus forms, brushing alone cannot remove it. Professional scaling becomes necessary.
But the story does not end there. Calculus provides an ideal rough surface for more bacteria. The bacterial population increases dramatically. More bacteria means more toxins and deeper inflammation. Eventually, destructive periodontal pockets begin forming. The supporting structures of teeth become threatened. In severe cases, even jawbone can be lost. And persistent bad breath develops. So how exactly does calculus become so harmful?
In Part 2, we'll explore the chemistry and biology of calculus itself. We'll uncover what calculus is made of, how it grows, and why scaling is essential for lifelong oral health. Welcome back. Let's begin by understanding exactly what dental calculus is. Dental calculus, commonly called tartar, is hardened plaque.
It begins as soft bacterial plaque, but changes dramatically over time.
As minerals accumulate within plaque, it slowly transforms into calculus. This hardening process is known as mineralization. One of the key minerals involved is calcium.
Another essential mineral is phosphate. When calcium and phosphate combine, microscopic crystals begin to form. Over time, these crystals expand and convert soft plaque into hard calculus. Now that we know how calculus forms, let's examine what it is actually made of.
Dental calculus contains two major components: inorganic minerals and organic material. In mature calculus, minerals make up the majority of the deposit.
Typically, about 70 to 90% of calculus consists of inorganic mineral substances. These minerals originate mainly from saliva and crevicular fluid around the teeth.
But calculus is not made entirely of minerals.
Lester. The organic portion contains large numbers of bacteria, both living and dead. It also contains...
These organic materials become trapped within the mineralized framework.
Even after hardening, calculus continues to harbor bacteria capable of irritating surrounding tissues.
These crystals tell an important story about how calculus develops and matures.
In the next section, we'll explore the major crystal phases found in dental calculus and their clinical significance.
Calculus may look like a simple hard deposit, but inside it contains several different crystal types.
These crystals form as minerals accumulate and mature over time.
The most common crystal found in mature calculus is called hydroxyapatite.
Interestingly, hydroxyapatite is also the primary mineral found in natural tooth enamel.
In newly forming calculus, a different crystal is often present. This crystal is called brushite.
Brushite is commonly found during the early stages of calculus development.
Not all calculus forms in the same location. The first type is called supragingival calculus.
The term supragingival simply means above the gum line.
One of the most common locations is behind the lower front teeth. This area receives a constant flow of mineral-rich saliva.
The minerals in saliva contribute directly to calculus formation. Another common site is near the upper molars. These teeth are located close to the opening of a major salivary gland.
When plaque remains undisturbed, minerals slowly harden it into calculus. These deposits create a rough surface that attracts even more plaque. As bacterial accumulation increases, inflammation of the gums begins. Redness, swelling, and bleeding are common early consequences.
But not all calculus is visible above the gums.
In the next section, we'll explore subgingival calculus, the hidden form of tartar that often causes the greatest damage. A periodontal pocket forms when inflammation causes the gums to detach from the tooth. The deeper the pocket becomes, over time, calculus extends deeper along the root. The rough surface acts like a shelter for millions of bacteria. These bacteria continuously release toxins that irritate the surrounding tissues. The body's immune response creates chronic inflammation. As inflammation progresses, the supporting fibers around the tooth begin to break down. This gradual bone loss weakens the support system of the tooth. Many people are unaware that this process is occurring because the deposits remain hidden. Subgingival calculus is often discovered only during a professional dental examination. Removing these deposits is one of the most important goals of scaling treatment.
Now let's see what happens when calculus remains on teeth for long periods of time. Calculus creates an ideal surface for bacterial growth. As bacterial colonies increase, they begin producing harmful substances. These toxins continuously irritate the gums.
The body immediately recognizes this bacterial activity as a threat. The immune system responds by sending defensive cells into the tissue.
Blood flow increases as the body attempts to fight the bacterial challenge. As inflammation develops, the gums begin to change in appearance. They become redder, softer, and more swollen than healthy tissue.
Even gentle brushing may trigger irritation.
This early stage of gum disease is extremely common. It is known as gingivitis.
The good news is that gingivitis is usually reversible.
The good news is that gingivitis is usually reversible.
But if inflammation continues untreated, a more serious disease can develop.
Now let's see what happens when calculus remains on teeth for long periods of time.
Calculus creates an ideal surface for bacterial growth.
As bacterial colonies increase, they begin producing harmful substances.
These toxins continuously irritate the gums.
The body immediately recognizes this bacterial activity as a threat.
The immune system responds by sending defensive cells into the tissue.
This protective response is known as inflammation. Blood flow increases as the body attempts to fight the bacterial challenge.
As inflammation develops, the gums begin to change in appearance. They become redder, softer, and more swollen than healthy tissue.
Brushite. The audio features a conversation between two men, accompanied by the sounds of brushing and scraping, likely suggesting it.
At this stage, the disease is affecting the gums but has not yet damaged the supporting bone. This early stage of gum disease is extremely common.
It is known as gingivitis.
The good news is that gingivitis is usually reversible. When bacterial deposits are removed, the gums can heal. But if inflammation continues untreated, a more serious disease can develop. In Part 3b, we'll explore
gingivitis is the earliest and most common form of gum disease. It develops when plaque and calculus remain undisturbed near the gums.
The bacteria release toxins that trigger inflammation. As blood flow increases, the gums begin to change color. Healthy gums are usually firm and pink, while inflamed gums appear red and irritated. Swelling is another common sign of gingivitis.
The tissues become enlarged because of the body's inflammatory response. One of the most noticeable symptoms is bleeding during brushing.
Many people assume occasional bleeding is normal and do not seek treatment.
As time passes, the inflammation may continue unchecked. The gums may become increasingly sensitive and uncomfortable.
If the cause of the inflammation is not removed, the condition can begin to worsen. The encouraging news is that gingivitis is usually reversible.
With proper cleaning and good oral hygiene, the tissues can heal. At this stage, there is typically no permanent loss of supporting bone.
But if gingivitis remains untreated, the disease can progress beyond the gums. This advanced stage is called periodontal.
If gingivitis is not treated, the inflammation continues beneath the gum line.
The bacteria begin moving deeper into the space around the tooth. The attachment between the gums and the tooth starts to break down. As this attachment is lost, a small pocket begins to form. This space is known as a periodontal pocket. The deeper the pocket becomes, the harder it is to keep clean.
These pockets create an ideal environment for harmful bacteria.
The bacteria continue releasing toxins that damage nearby structures.
The body's immune response contributes to tissue destruction during the battle against infection.
The fibers that normally anchor the tooth begin to deteriorate. This process is known as attachment loss. Dentists measure these pockets to assess the severity of periodontal disease. In the next section, we'll see how periodontitis leads to bone loss and tooth instability.
To understand tooth mobility, we first need to understand the bone that supports our teeth.
Each tooth is held firmly in place by the surrounding alveolar bone.
In a healthy mouth, this bone provides stability and support during chewing. But when periodontitis develops, inflammation extends beyond the gums. The infection and the body's immune response begin affecting the supporting bone. Specialized cells start removing bone in an attempt to respond to the ongoing inflammation.
Over time, the bone level slowly begins to decrease.
This process is known as periodontal bone loss. As bone support is lost, less of the tooth remains anchored within the jaw. Bone loss often develops slowly over months or even years. At the same time, periodontal pockets usually become deeper.
This allows bacteria and calculus to spread farther beneath the gums.
As supporting structures are lost, the tooth may begin to feel less stable. The greater the bone loss, the greater the risk of tooth mobility.
Some patients first notice this when chewing or biting.
Dentists often evaluate bone levels using clinical examinations and dental radiographs.
Without treatment, bone loss can continue and eventually threaten the survival of the tooth.
But periodontitis causes more than bone loss. It is also a major cause of persistent bad breath.
Bad breath, also known as halitosis, is one of the most common complaints associated with calculus buildup.
The problem usually begins with bacteria living on plaque and calculus. The rough surface of calculus provides Many of these bacteria thrive in deep periodontal pockets where oxygen levels are low. As these bacteria digest proteins and debris, they produce waste products. Some of these waste products are sulfur-containing compounds. These sulfur compounds are largely responsible for the unpleasant odor associated with bad breath. The greater the bacterial activity, the stronger the odor may become. When calculus remains untreated, it continuously supports bacterial growth.
Many people attempt to solve the problem using mouthwash alone.
While mouthwash may temporarily mask the odor, it often does not eliminate the underlying cause. If bacteria remain protected within calculus and periodontal pockets, the odor frequently returns.
This is why professional scaling is often an important step in controlling chronic bad breath. Removing calculus reduces the surfaces where bacteria can accumulate. As gum health improves, bacterial activity and odor production often decrease.
Many patients notice fresher breath following successful periodontal therapy, but the consequences of periodontitis extend beyond bad breath.
In the next section, we'll discover how gum disease eventually leads to tooth mobility and instability. One of the most concerning effects of advanced gum disease is tooth mobility. To understand why teeth become loose, we must first understand how teeth are normally supported. Each tooth is supported by bone and a network of specialized fibers called the periodontal ligament.
Together, these structures keep teeth stable during chewing and biting. During periodontitis, the periodontal ligament gradually loses its attachment to the tooth and bone. At the same time, the surrounding bone may begin to resorb.
As more bone is lost, the tooth has less support holding it in position. The result is tooth mobility. Patients may notice movement when chewing, biting, or touching the tooth.
Gum recession often accompanies this process, exposing more of the root surface. Many patients report that their teeth appear longer than before. The mobility is not caused by scaling. It is caused by the loss of supporting tissues from periodontal disease.
In some cases, large calculus deposits can partially mask existing mobility.
The hardened deposits may temporarily make teeth feel more stable than they actually are.
Once the calculus is removed, the true condition of the supporting tissues becomes apparent. This is one reason some patients notice looseness after scaling. Fortunately, removing the infection gives the tissues the opportunity to heal.
In many cases, stability improves as inflammation decreases. But another common question remains. Why do teeth...
One of the most common questions after scaling is, why do my teeth feel sensitive now?
To answer this, we first need to understand what calculus has been hiding.
In many patients, gum disease has already caused gum recession and root exposure.
When scaling removes these deposits, the root surfaces become exposed to the oral environment. The scaling procedure does not create...
Unlike enamel, root surfaces contain microscopic channels called dentinal tubules.
These tiny channels communicate with the inner portion of the tooth.
When cold, hot, sweet, or acidic stimuli reach these two.
The nerves interpret this as a brief, sharp sensation.
As inflammation decreases, the gums begin returning to a healthier shape. During the healing phase, the tissues gradually adapt to the new environment. Many patients benefit from desensitizing toothpaste during this period.
For many patients, the sensitivity is temporary. The long-term benefits of removing infection greatly outweigh this temporary discomfort.
Scaling removes the cause of disease and allows healing to begin. Cleaner teeth, healthier gums, and fresher breath are all part of the recovery process.
In next step, we will show you dental clinic and explore exactly how scaling is performed.
Before scaling begins, a thorough dental examination is performed to evaluate the overall health of the teeth and gums.
The dentist looks for plaque, calculus, inflammation, and signs of gum disease chair, paying particular attention.
The depth of gum pockets is measured. In healthy gums, these spaces are shallow. Deeper pockets may indicate periodontal disease.
347. Radiographs reveal bone loss that may not be visible during routine examination.
By combining clinical examination and radiographic findings, an accurate diagnosis can be made.
Once the examination is complete and treatment is planned, the next step is selecting the appropriate instruments for calculus removal.
One of the most commonly used tools is the ultrasonic scaler, which uses high-frequency vibrations to break apart hardened calculus. In the next section, we'll see in detail how ultrasonic scalers systematically break apart and remove hardened calculus from tooth surfaces. Although ultrasonic scalers are highly effective, hand instruments remain an essential part of periodontal treatment. These instruments are specially designed to remove deposits with precision. The most commonly used instruments include curettes and hand scalers.
Each instrument has a specific shape intended for different areas of the mouth. Hand instruments are particularly useful for cleaning below the gum line.
The curved design allows the instrument to adapt to root anatomy. This helps remove deposits that may remain after ultrasonic scaling.
Even tiny remnants of calculus can be detected and eliminated. The goal is to leave the root surface as clean as possible. Hand instruments provide excellent control in difficult-to-access areas. They are especially valuable around complex root structures.
Together, ultrasonic and hand instrumentation complement one another. Combining both techniques often provides the most thorough result.
After deposits are removed, the clinician carefully evaluates the treated areas. The cleaner the root surface, the better the conditions for healing.
Some of the most challenging deposits are found deep below the gums. These hidden deposits often require meticulous subgingival scaling. In the next section, we'll explore how dentists remove calculus hidden deep beneath the gum line.
One of the most effective tools used during scaling is the ultrasonic scaler. At first glance, it may look like a simple metal instrument,
but its tip vibrates thousands of times every second. These high-frequency vibrations are powerful enough to disrupt hardened calculus. Rather than scraping aggressively, the instrument uses vibration to fracture the deposit. The hardened tartar gradually breaks apart and detaches from the tooth.
A stream of water is delivered at the same time. This water helps cool the instrument and flush away loosened debris.
The combination of vibration and water can also help reduce bacterial buildup. Large deposits can often be removed.
The result is a cleaner tooth surface and improved access for further treatment. Most patients experience vibration.
Daffodil. A suction device is commonly used to keep the treatment area clear and comfortable. However, not every area can be.
For fine details and difficult-to-reach areas, hand instruments are often used. These specialized instruments. In the next section, we'll explore how hand scaling instruments help achieve a thorough cleaning.
Some of the most harmful calculus deposits are completely hidden beneath the gum line. These deposits often remain undetected.
Hidden calculus provides a protected environment for harmful bacteria. They continuously release toxins that maintain inflammation and drive periodontal destruction deeper. Before treatment, the dentist evaluates the depth and extent of the periodontal pocket. This measurement guides the entire cleaning approach. Specialized ultrasonic tips are designed to reach deep beneath the gums. The vibrating tip carefully disrupts and loosens the hardened deposits. Hand curettes provide precise access to areas that require detailed cleaning. Once the deposits are removed, the source of chronic irritation is greatly reduced. The surrounding tissues can now begin. The gums gradually tighten around the clean tooth. The ultimate goal is to create an environment that is easier for both the patient. But what does scaling actually feel like from a patient's perspective?
Many patients wonder what scaling actually feels like during treatment.
For most people, scaling is a safe and well-tolerated procedure.
The most noticeable sensation is often the vibration produced by the ultrasonic scaler. Patients may feel a gentle buzzing sensation against the teeth. Many patients also notice a high-pitched sound created by the instrument. At the same time, cooling water is delivered throughout the procedure. This water helps keep the tooth and instrument cool while washing away debris.
Cold water or contact with sensitive root surfaces can occasionally produce a brief, sharp sensation. For deeper cleaning procedures, local anesthesia may be recommended.
Many patients immediately notice that their teeth feel smoother and cleaner after treatment.
A common comment after scaling is that the teeth feel remarkably different.
In the days and weeks that follow, the gums often become healthier and less inflamed.
In the next section, we'll explore exactly what happens during the healing phase after scaling.
Once scaling is complete, the healing process begins almost immediately. For the first time in months or even years, the gums are no longer surrounded by bacterial deposits and calculus.
The bacterial burden is significantly reduced. As the source of irritation is removed, inflammation begins to decrease.
This healing can make the gums appear slightly smaller than before treatment. In reality, the calculus was filling those spaces and masking the true anatomy.
Gums become healthier, bleeding decreases, and the risk of disease progression is reduced.
Most importantly, scaling helps preserve the supporting structures that keep teeth functional for years to come.
In the next section, we'll learn how to prevent plaque and calculus from returning.
After investing time and effort into scaling, the next question is simple. How do we stop calculus from coming back?
The answer starts with understanding that plaque begins forming again within hours, even after a professional cleaning.
The most important defense is effective daily toothbrushing. Brushing helps disrupt plaque before it has an opportunity to mature.
When plaque is removed regularly, it cannot easily mineralize into calculus.
Using a fluoride toothpaste supports overall oral health and helps protect tooth surfaces.
However, brushing alone does not clean every area of the mouth. Daily flossing helps remove plaque from areas between teeth. For some patients, interdental brushes may provide even better access. A balanced diet also contributes to better oral health. Frequent exposure to sugary foods can encourage bacterial growth.
Regular dental examinations remain an essential part of prevention.
Despite being one of the most common dental procedures, scaling is often surrounded by myths and misconceptions. Let's separate fact from fiction. Professional scaling targets plaque and calculus width, not your enamel. The instruments are designed to remove disease-causing deposits while preserving the tooth beneath. Those gaps were already there, filled by hardened calculus. Scaling doesn't create the spaces. It reveals what disease was hiding.
The looseness was caused by periodontal disease, destroying the supporting bone. Calculus was simply masking the damage.
Scaling doesn't weaken your teeth. It removes the bacterial deposits that threaten them. Clean teeth are stronger teeth.
Scaling is far more than cosmetic. Scientific evidence confirms it plays a vital role in preventing gingivitis, managing periodontitis.
When it comes to oral health, evidence should always guide our decisions. Healthy gums, fresher breath, stable teeth.
From plaque to calculus, from disease to treatment, professional scaling is one of the most important steps you can take for your oral health. Despite being one of the most common dental procedures, scaling is often surrounded by myths and misconceptions. Let's separate fact from fiction. Professional scaling targets plaque and calculus width, not your enamel. The instruments are designed to remove disease-causing deposits while preserving the tooth beneath. Those gaps were already there, filled by hardened calculus. Scaling doesn't create the spaces. It reveals what disease was hiding.
The looseness was caused by periodontal disease, destroying the supporting bone. Calculus was simply masking the damage.
Scaling doesn't weaken your teeth. It removes the bacterial deposits that threaten them. Clean teeth are stronger teeth.
Scaling is far more than cosmetic. Scientific evidence confirms it plays a vital role in preventing gingivitis, managing periodontitis.
When it comes to oral health, evidence should always guide our decisions. Healthy gums, fresher breath, stable teeth.
From plaque to calculus, from disease to treatment, professional scaling is one of the most important steps you can take for your oral health.
Over the course of this documentary, we've followed the complete journey of dental plaque and calculus.
When plaque is not removed regularly, it becomes thicker and more complex, a structured community of bacteria working together. Minerals from saliva slowly harden the plaque through a process called mineralization. The result is calculus caphrates, also known as tartar. As bacteria multiply, the gums become inflamed, a condition known as gingivitis. Left untreated, it can progress into periodontitis.
Fortunately, this destructive process can often be interrupted. Scaling removes plaque and calculus, while careful.
As inflammation decreases, the tissues begin to recover. Bleeding is reduced. Gum health improves.
Healthy gums are the foundation of a healthy smile. Prevention remains far easier than treating advanced periodontal disease.
We've come to the end of this journey inside dental science.
From plaque formation to calculus buildup,
to professional scaling, and finally, healing.
What we learned is simple. Oral health is built on awareness and prevention. At Dr. Sila Biolabs, our mission is to bring science-based dental knowledge to everyone.
Every subscription to this channel is more than just support. It directly contributes to awareness and welfare initiatives that help people in need.
So please subscribe to Dr. Sila Biolabs and stay connected with us.
Your support helps us continue creating meaningful, educational, and welfare-focused content.
Stay with Dr. Sila Biolabs and keep smiling with knowledge.